This is Harvey, an ordinary guy who had an up-close experience with a small tree that gave him the opportunity to meet some new people. Each of them had different educational background and skills that would help Harvey with another new experience: pain. Medical doctors and physician assistants are trained in the classic medical model, where pain is used to make a diagnosis. Important clues are the location of pain, its onset and duration, the character of the pain, and any aggravating or relieving factors.
Is there nothing I could take? I say, doctor, to relieve this bellyache. I say, doctor, is there nothing I could take? I say, doctor, to relieve this bellyache. I say, now let me get this straight.
There are many pharmacological interventions for treating the symptom of pain. For acute pain, they range from NSAIDs to narcotics. In cases of chronic pain, medical education teaches that selective serotonin and norepinephrine reuptake inhibitors like duloxetine work better without the addictive potential of opioid painkillers. During Harvey's hospital stay, an important part of his pain management was handled by another professional on his care team. Nurses are taught that pain is the fifth vital sign, that pain is whatever the patient says it is, and that it occurs whenever the patient says it does.
He will be gone.
Doctors, PAs, and nurses are all well educated on the physiological mechanisms of pain, but successful pain management requires that they understand that pain is multidimensional.
Where do I go?
Attentive monitoring of pain, including emotional, social, and spiritual aspects, is most important at this stage because appropriate pain control reduces the likelihood of acute pain leading to chronic pain.
So tired of having to choose where I'll be and what I'm gonna do.
Because our patient Harvey's injuries included facial trauma, his treatment required a dentist. Dentists are well versed in the neurophysiology of the head and neck. In pain management, they use their skills to prevent, diagnose, and manage intraoral and orofacial pain.
You know when to let go. Where does the good go?
In addition to restoring Harvey's smile, his dentist plays an important role in his continuum of care, recognizing the relationship between acute, incident, breakthrough, and chronic pain.
Look me in the eye and promise no love's like I love.
Like most trauma patients, Harvey's injuries required physical therapy. The physical therapist is trained to treat a patient following the biopsychosocial model, which looks at the patient as a whole. A vital part of pain management, physical therapy focuses on remediating impairments and disabilities while promoting mobility, functional ability, and quality of life.
Someone said today there's no other way of praying.
At this point, it is vital that Harvey's interprofessional care team continue to monitor his pain and his response to treatment. Nociceptive pain is the type of pain Harvey experienced from his injuries. It usually resolves as the tissue damage heals. However, if this kind of pain persists after the injury is healed, it may evolve into neuropathic pain, creating a chronic pain condition that is a disease in itself. The mechanisms of this phenomenon are not completely understood, but it is believed that the long-term potentiation of spinal neurons is molecularly similar to processes that are involved in the formation of memories in the brain. As Harvey's pain condition was developing along a worrisome trajectory, his team added a social worker. The social worker brings advocacy and self-advocacy to the patient. Cognitive behavior interventions and restructuring reduce the stress, helplessness, and hopelessness that can occur with chronic pain. Other approaches to effectively deal with pain include distraction, self-monitoring, relaxation techniques, imagery, and hypnosis. Sometimes pain is disabling and can affect a patient's livelihood. Social workers bring resources to lend support in difficult times. Now this is Harvey, an ordinary guy who learned that it takes a team of professionals working together to put the pain behind him and to let Harvey be Harvey again.
Pain in my heart, treating me